In this video, we are going to talk through ways to modify your sleep position in order to reduce and help your hip pain. The video is divided by sleeping position, so feel free to go ahead and just jump right to the section corresponding to how you sleep. Importantly, there is no one-size-fits-all or perfect sleep position, even if the internet tells you otherwise. What is best for you depends on why you hurt. For example, tendon pain will be aggravated by different things than arthritic pain. This means a position that feels great for you can be horribly painful for someone else. So, try these modifications to see which, if any, feel better. It'll take trial and error. Let's go ahead and dive in. If you sleep on your back, there are three main modifications. Number one is the classic pillows under the knee, which often helps, but you have also likely already tried. Number two is placing a pillow or other object between the thighs to keep the legs more apart. This can help with many diagnoses, including pain both in the front and on the side of the hip. Number three is to place a pillow directly under the glutes rather than the low back. This pulls the hip into an extended position, which can be more comfortable in certain cases of arthritis and other conditions. If you sleep on your side, there are four main modifications. Number one is what you have probably already tried, which is placing a pillow between your knees. This position can help pinching in front of the hip and pain on the bony outer portion of the hip for different reasons. Number two and number three both apply to people with pain specifically on the outer hip. Number two is to place a pillow, blanket, or other object under the hip. Number three is to take a towel, roll it up, loop it together like a donut, and then place it so that the bony edge of your hip goes into the hole when you lay down. Either of these options will reduce the amount of compression on that area of the hip and so tends to feel better. Number four is to partially rotate your trunk. This sounds odd, but rotating the trunk changes your hip position and so can feel better for many diagnoses. To do this, just place pillows either behind the back or in front of the chest or the hips to block yourself into the rotated position. If you sleep on your stomach, there are three main modifications. Number one is the classic, putting a pillow or pillows, depending on your comfort, under your hips. This takes force off many of the commonly affected structures. Number two is to place a pillow under the feet or the shins in order to place a slight bend in the knee. Doing so reduces tension on some of the hip muscles in front of the thigh, which may help out. Number three, you can also try spreading your legs out so that there is more space between the thighs. A pillow can be placed in between to block them, which may help in multiple conditions as well. That brings us to the end of the video. As mentioned, there is no one-size-fits-all position. Just go with whatever it is that lets you sleep best. Because in the end, getting quality sleep will do far more for you than trying to force yourself into a perfect or an ideal position.